In some cases, Dr. Henry, is that a practice that should continue? And lastly, we're getting a lot of questions on our Facebook Live to you, Dr. Henry. You're speaking about the work health officials are doing, but people are hoping that you're well and that you have the rest you need. Do you think there will soon be an opportunity for you to at least get a little bit of rest?
Thank you. That's very sweet. I'm hoping that we'll have a day of no media on Sunday. But this is something that we're all committed to, and I'm not the only one. I'm the face of a whole team of people who have been working around the clock for a long time on this, and will continue to, because it is just so important. And we have seen, particularly in the last week, how it's affecting all of society here. And we have to continue to do that. In terms of open houses, I think there's businesses that can and do need to continue to move on or to continue to work and to be open around this crisis. And there's people that are relying on being able to sell their home to be able to do other things in their lives. However, it has to be done in a way that protects the safety of everybody. So that means that would have to be a one-on-one, and you'd have to be able to maintain distance. So as long as those parameters can be put in place, I think it is safe for businesses to carry on certain functions. And I don't have the answer to the eviction question.
In principle, there shouldn't be any evictions due to COVID-19. Richard, I'd be happy to get the information from what you're getting, and I know that people involved in the housing ministry will have things to say about that. So we'll get you more information on that, but in principle that shouldn't happen. It's hard to resolve cases that come forward in this venue, but I would say in principle that we shouldn't be evicting people at this time.
Thank you. Nick, next question is from Nick. Go ahead, please.
Hi, Dr. Henry. You've been very clear about restaurants and bars and the course that they should be taking. What's the direction for other non-essential businesses that can have hundreds of staff working in one place? And what's the recourse for concerned employees who may be working for a company that's not doing the best practices?
Right. So as I've said, there are many businesses that can and should stay open. We want to make sure that we have the economy to be able to support both the healthcare workers and the rest of us to be able to get the food we need to keep the lights on. There's many, many reasons. And part of that is, some businesses supporting people in continuing their work and being paid so that they're able to do these work. So it's not trying to shut down everything that is important. But what is important is the reason we're doing this is not just to keep people off business. The reason we're doing this is to prevent transmission of the virus. So the principles behind it are to ensure that we're not congregating in places where people can be close together and be transmitting this virus. So businesses need to take the measures to make sure that it's done in a way that is safe and the way that it reduces the possibility for people coming in contact with each other and passing this virus. And there are many that can do it, and there's many that need to take extra precautions, like things like truckers monitoring your symptoms, monitoring yourself, your health every day, having an active monitoring program, making sure you're able to clean your hands, that you maintain space when you're around others. So there are things that every business needs to do, and the recourse is through their own HR management. And I go back to if we have transmission in a business setting, it affects that entire business, and that will be a long-term effect. So these are short-term things that people need to do now to try and build those distances in to prevent us from having those long-term effects and prevent your own business from having those long-term effects.
Thank you. Next question is from Andrea Vu.
Oh, hi, Dr. Henry. I was hoping you could just clarify how many residents and how many healthcare workers at the Linn Valley have tested positive in total.
At the Linn Valley Care Centre, there's been 36 residents who've tested positive, and tragically 8 of those people have died. We've had 18 healthcare workers from the Linn Valley Care Centre who've been positive. None of them have been hospitalized. All of them are doing well, and many of them had very mild illness.
Thank you. Next questions will be from Srushti Gangdev, followed by Brishti Basu, and then Tanya Fletcher. Srushti, go ahead, please.
Dr. Henry, hi. I'm just wondering if there's any insight you can give about our case count versus Ontario's. It seems like we're kind of outpacing Ontario every day. We have a population of about 5 million. They have about 15 million. Are they doing a better job of stemming community transmission or flattening the curve than we are?
Yeah, very good question. I think the transition, our outbreaks are slightly different. We are, unfortunately, many of our cases are related to, as you know, the Linn Valley Care Home and the other care homes. So we have clusters of cases. We also, have a number of community spread, as they do as well. So it's hard to compare. And it's a matter of the amount of testing we're doing as well, and the areas that are being tested. So I don't like to speculate. I think in any one day will be more or less than them.
Thank you. Next question is from Brishti Basu. Go ahead, please.
Hi, Dr. Henry. We're still getting a lot of questions from readers about why the communities or municipalities with confirmed COVID-19 patients are not being released. Can you just clarify why health authorities are citing patient privacy as a reason when they gave out details of patients with the measles outbreak earlier?
Yeah, so measles, as we know, is very different from this. And measles can be spread in the air after somebody has left the room. So we need to give people an idea of where they might have been in contact with it. We're not seeing that with this disease. I will say, however, and that was very much early on, where we had individual cases and there was one or two people that could be identified in a community. We're now at the place, though, where it's irrelevant what community you're in. The risk of this virus is everywhere in British Columbia, everywhere in Canada. And that has been the evolution of this virus, not just in BC and in Canada, but around the world. So we cannot say, it doesn't make any difference whether somebody was in North Shore or in downtown Vancouver. We all need to do our part right now to take these measures to prevent transmission of viruses across the province. And that is because people are traveling a lot, people work in one place, they live in another. We know there's been hundreds of Canadians and people coming back to BC from around the world that may be incubating or may have early symptoms of this virus. So knowing where somebody was 2 weeks ago when we detected them is not what is going to protect you now.
Thank you. The next question is from Tanya. Tanya Fletcher, go ahead, please.
Hi, Dr. Bonnie Henry or Health Minister, either of you. We're seeing those lockdowns in California and New York now as well. So life here in BC is gradually becoming more restrictive. I know you're implementing these measures kind of gradually. To what extent are you preparing us for the eventuality of a possible shelter-in-place order?
So, there are many different ways of looking at it, and if you parse out what we're doing and what other jurisdictions are doing, I think you'll find a lot of similarities. We're all looking at the same thing. What are the things that we need to do to prevent the transmission of this virus in our communities? So we've been, I guess it takes some time to really help people work through what does this actually mean for us. And I will say that we're doing this far earlier in the trajectory here in BC and in other parts of Canada than what we have seen in many other places around the world. So the measures are actually fairly similar if we look at the details of them, and it's just called different things in different places. I will say, however, that the whole concept of shelter in place is something that we've been saying a long time now, particularly for people who are more likely to have severe illness. So our elders and seniors, people with underlying chronic conditions or disabilities that might make them more likely. I've been asking them to stay home and stay away from others, and us as a community to support those people. And we saw the initiative that Isabel McKenzie is going to be leading to make sure that we can best support those people, the people in our communities that need it most.
Thank you. The next questions would be from Marcella Bernardo, Jane Said, and Fran Yanor. Marcella, go ahead, please. Marcella Bernardo? We'll take the next question from Jane. Jane Said, are you there?
I have more questions on the Linn Valley Care Center situation. Just to clarify, you said that, I just want to clarify, first of all, the number of deaths. You say that 8 people from that care center have died, and is that 8 people from that care center? And so overall,